Good afternoon, everyone. My name is Danielle Morris, and I am the Global Health Equity Lead for AWS's Social Responsibility and Impact team. I am really excited about this, what will surely be a dynamic conversation. We're going to have a bit of a mix of presentation and panel discussion, and we will make sure to leave time for Q&A. But one of the reasons I'm really excited about this conversation is that we're able to talk about how innovative and cutting-edge technology such as generative AI is being applied to real-world situations to improve the health and well-being and quality of life of populations around the world. So I am being joined by two panelists who will introduce themselves with their presentations. But please, as you're listening to the conversation today, I have one ask of you, and that is to really think about how you can take the learnings from today's conversation back into your everyday lives and your organizations to drive social impact with generative AI and technology. So without further ado, pass the mic.
Hi, everyone. Good afternoon, and thanks for being here. My name is Kingsley Undo. I'm the founder and CEO of Huron AI. We're a medtech startup that utilizes generative AI and other AI applications to make precision care accessible and available for everyone around the world. We're mainly focused on underrepresented populations, and we're also focused on improving drug safety in these populations. Today, we only have one oncologist to 3,000 cancer patients in Africa. Think about that for a second. Compared to the United States, where we have only one oncologist to 300 cancer patients. This means that patients will have to travel long distances to see the oncologists. When they have side effects, it's very difficult to manage these side effects, and doctors are just overwhelmed with the patient load. So at our startup, we think about how can we use a culturally sensitive artificial intelligence to ensure that physicians can do their work more efficiently and have patients have access to remote care when they need it. The other problem we're solving is the gap in clinical trials. You know, in the past 20 years, all the FDA-approved cancer medications, only less than 3% of the trial participants were of African descent, and less than 6% were of Hispanic descent. This means that a lot of the efficacy and safety data that we have today is not truly representative of the population. And so at our company, we're thinking about how can we innovate, how can we show clinical trial readiness reports in our partner sites and ensure that we can leverage our software and generative AI tools to do things like cohort discovery and ensure that we have more recruitment of underrepresented populations around the world. This is just a visual of a patient's journey, a cancer patient's journey. And this is by no means exhaustive, but you can see that there are many pain points and there are many things to think about when we're thinking about AI solutions to make this whole process efficient and ultimately to improve patient outcomes. At our company, we're focused on treatment. At this point, we're focused on treatment, survivorship planning, and side effects management. And so we designed a solution called Gokiza. Our initial focus is in Africa and Latin America. And so the first place we tested our technology was at the Rwandan Cancer Center. Rwanda is a country of 13 million people with only 13 oncologists. And so Rwanda was a very good place to launch. This is where other Silicon Valley companies had launched, like Zipline. We're based in Seattle. But I'm originally from Nigeria and have worked in global oncology for over a decade in Seattle. And so I have leveraged partnerships in these sites around the world to build this company. And our solution is a two-way communications platform. We have the physician-facing side, and we have the patient-facing side. When patients are diagnosed with cancer, we have an API that can draw data from EMRs, or we have a very easy-to-use system where you can record things like demographic data and clinical data. And then through predictive analytics, patients get questions about their side effects. They can answer yes or no, and then they score these side effects. And we have an intuitive dashboard where the oncology care team can see how each of their patients are doing in real time. And with a click of a button, they can generate personalized messages to these patients that incorporates their demographic data, their level of literacy, what kind of chemotherapy that they're taking to address these side effects. They can also, with a click of a button, see if their treatment plans are in line with the guidelines that have been approved to ensure that they're providing the right treatment. Patients, on the other hand, when they report side effects that are potential emergencies, system flags them immediately to call a certain number, the emergency number, to go to the hospital. And so patients can get remote care through this way, and our system is designed in such a way that even if patients do not understand English, the messages they get will be in their local language, in this case, Kenya, Rwanda. So patients were able to interact with the platform and ensure that they were managing their side effects or concerns as the need arose. And this is one of the major things that we're looking at as a startup, the concept of algorithmic bias. I often say that if a patient presents to a family physician here in Las Vegas, and they come, let's say it's a 28-year-old young man, comes with fever, night sweats, and some weight loss. The first thing the physician will be thinking about is Hodgkin's lymphoma, which is a kind of cancer. But if you go to a place like Nigeria and present with those same symptoms, the first thing that the doctor is going to be thinking about is malaria. So if you design algorithms and use data to train here, you can't just export that technology. We have to build culturally sensitive technology that it's responsive to the algorithms, the data, the epidemiology and the clinical context of those regions. And I like to show this diagram. This is Kaposi sarcoma. On the left, or on your right, is Caucasian or lighter skin. It's a kind of skin cancer. If you train an algorithm to identify this cancer, and you use mostly Caucasian skin, it's going to misidentify, Kaposi sarcoma in black skin, and that's why data representation and diversity is very important to us. And we have to, because this is a relatively new technology in the regions that we serve, we have to ensure that our design is multidisciplinary. We ask a lot of questions. We co-build with oncologists to ensure that we are really addressing pain points, both in the healthcare system and for the patients. We also try to explain to physicians how the algorithms reach the decision so that they will have more trust and so that patients can have more trust in this technology. This is just the beginning, and we have a long road ahead of us. And so other things we do on our platform is a doctor can call, or a nurse can call a patient directly from our software. They just need to click a button. When they have those conversations, it's recorded, it's saved, and we have clinical summaries. And we've been using Amazon, the tools, the foundational models on Amazon Bedrock, which really makes generative AI very transparent, and it's not just a black box. We can fine-tune to ensure that we're responsive to the regions that we serve. And so this is just 3-month data when we first did our pilot. It took about 7 months for us to get an IRB approval because we were the first organization to have submitted any form of research that had to do with artificial intelligence to the Rwandan government. So it took a lot of back and forth for them to really grasp the concept. But we had very good engagement. As you can see, that patient engagement was at least 92%. We had about 480 patient interventions, and out of that, 9 of them were automatically detected emergencies. And there have been a lot of excitement about our use of Bedrock and about our use of this technology in patient engagement and symptom management and side effect management. And we recently just expanded to Nigeria and Kenya, and we're almost in Brazil, in the 3rd largest cancer center there. And we're really excited for our next phase of growth. And I don't do this alone. There's an excellent team behind us that works every day it's a lean team, as you can see, and we're growing, but we work every day to ensure that we can make cancer care equity a tangible reality in our time. Thank you so much. Thank you.
Thank you, Dr. Kingsley. Thank you for sharing that inspiring story of how generative AI is transforming access to cancer care. I'm Rudd. I'm a principal solutions architect with AWS for Nonprofits. Thank you for joining us. In my part of the presentation, I'm going to be going into some of the use cases that you can be thinking about. What Dr. Kingsley mentioned is basically a clinical virtual assistant, right? But there are really a lot of different use cases that you can build for using generative AI technologies. So I'm going to take you through some of those examples and then give you some key considerations for building your own generative AI applications, and then leave you with something actionable where you can go deploy an end-to-end generative AI application in an AWS account in just a few minutes, and then get hands-on with it. So let's get into it. So really, your generative AI journey starts with identifying your use case. And then once you identify that use case, you work backwards from it. So think about what kind of application you want to build. Is it something that's external facing, where you have your end users accessing it? Or is it something that's maybe facing your internal employees, right? So something that you want to use to boost your employee productivity, or even make your organizational processes more efficient. So think about that. And just to get you started, some examples. This is not a comprehensive list, just a really small subset of what you can do with it. So starting with end user experience. You can pretty much build any virtual assistant that you can think of, right? Just given the capabilities and the choices of foundation models today, if you can imagine it, you can build it. So you can essentially have maybe a legal assistant or a research assistant, or maybe even your own personal concierge who can make vacation plans for you. And then, of course, you can use the capabilities of foundation models that would power your applications to do creating your own personalized content. Or if you're looking to kind of, let's say, improving the productivity of your programmers, you could use foundation models to generate code or give code suggestions. So think of that as a coding companion, right? And then when it comes to improving the organizational processes, you could be looking at intelligent document processing or having conversation with your documents and so on. So it's really unlimited at this point. Like I said, if you can imagine it, you can build it. So really, no matter your use case, there are some key considerations that you have to take into account before you even start building. So, and these are really centered around selecting a model that serves your use case, because really there's no one size fits all. At this point, there are hundreds of foundation models. They can be proprietary or publicly available, and also different sizes and the kind of the size of payload or context window that they support, right? So model selection is critical. So I'm going to kind of give you some pointers around how you can do this guidance, but it all starts with the use case that you're building for. So when you start looking at models, you want to be thinking of, first you need to do your research, right? Go look at model cards. So model cards are transparency resources which tell you the kind of use cases that that specific model supports, any limitations, and sometimes if it's a publicly available model, it'll give you information on the data that it was trained on. So things like that. And then secondly, there is publicly available information on benchmarking. So there's, for example, Stanford University's HELM, which stands for Holistic Evaluation of Language Models, which provides, it's basically a framework, and it provides benchmarks across different scenarios and for various different metrics. So a scenario is basically a task. So this could be like text generation or summarization, Q&A, information extraction, what have you. And then the associated data set that it was used to benchmark that model. And then the metrics are things like, it's not just accuracy, right? When it comes to generative AI, there's a lot more to it than compared to traditional models or traditional machine learning. So with generative AI, you're not just looking at accuracy, you're also looking at things like fairness, bias, toxicity, calibration. So if you're not familiar with calibration, it's basically knowing what the model doesn't know, which is super important, especially because models can hallucinate. And the other things are like robustness, are you able to break a model, and efficiency, things like that. So there are a lot of different metrics that you have to think about when you select a model. So HELM is just one resource that you can use. But it's not sufficient. If you really want to pick a model and maybe do a POC and then put that into production, you also have to have a really rigorous evaluation process. So by that, I mean coming kind of, once you identify your use case, coming up with data sets that are specific to your use case or your industry or your domain, and then defining the metrics that you're going to be using to benchmark that model maybe against other models. And then also automating the whole process, because it's likely that you're going to be using this model evaluation process many times over as you work with several different models. So that's kind of the crux of how you would select a model. And then depending on your use case and then the model that you select for it, you kind of go into some customization. And almost always there is a level of customization that you have to do. And I'm going to go into that in just a little bit. And then when it comes to generative AI, data is your differentiator. And so keeping that data private and secure is paramount. And then the last consideration is, how are you going to be using, what kind of infrastructure would you use? Do you want to go for inferencing? So do you want to self-manage this infrastructure, or do you want to go with like fully managed options, right? So this is a factor that's going to drive cost, for example. So diving a little bit deeper into the model selection process, I talked about a lot of things, but really there are three key dimensions to think about. One is output quality. So this is the quality of the response that comes back from the model, right? And you should be looking for not just accuracy, like I said, there are a lot of other things. There are aspects like fairness, bias, toxicity, the robustness, and also appropriateness of the responses that come back. So all of those kind of go into that umbrella term that's called quality. And then cost is a huge consideration, because these, especially if it's an external facing application, you really need to know your end users. How many end users you have, what are the traffic patterns, how many inferences are you going to have to this model, every day, every week, every month. All of that can really add up to those costs, right? So having a sense for what the traffic looks like, and also the payload. So payload is, how many tokens, for example, are you passing in the prompt to a foundation model, and how many tokens are being output as part of the response. So all of that goes into kind of planning for cost, estimating your costs as you deploy these models for inferencing. The last dimension is latency. So this really depends on your use case. If it's an external facing model, then you want your customers to have a good experience. So you want a high performing model on the back end, but also really low latency. But on the other hand, if you have an internal facing application, for example, like document processing, that can be maybe a bit more tolerant to latency. So that's how you think about it. But bottom line, you need to kind of strike a balance between all these three dimensions so that you then get kind of a holistic evaluation and a model that kind of balances across those three dimensions. So getting into kind of the other consideration that I was talking about, which is customization, right? There are different levels of customization, and the approach that you pick will require time and effort and expertise. So, and the level of customization, the way you choose the approach will depend on the model that you selected. So if your base model is a really good, robust, safe, high quality model, the level of customization that you have to do will be much lesser. But there's almost always, there's some level of customization that you have to do, and it usually starts with prompt engineering. So prompt engineering is basically kind of defining your prompts. That means the requests that you're sending to the model, being kind of crisp, very specific about the task you want that model to execute, as well as things like maybe providing some context or examples so that your model can understand and respond in a more accurate fashion. So this is a technique that's part of prompt engineering that we call as few-shot learning. Few-shot learning is basically giving some examples so that your model can learn in real time at the time of inference without actually changing the underlying parameters. Another technique that you might have heard a lot about, especially with the keynotes from yesterday and today, is retrieval augmented generation, or RAG for short. So this is a more advanced prompt engineering technique, and what it does is it basically provides additional context from your trusted source of documents, for example, and then adds that to the original prompt from the user, and then sends that to the foundation model so that the model can then come back with more accurate, relevant, and context-specific responses. And then kind of further and deeper level of customization is fine-tuning. So fine-tuning is where you're bringing in label data and then actually taking the model through a training process. But the number of parameters that you actually change it's a really, really small fraction. But the idea is that you're now kind of customizing it with your data to that very specific task that you're trying to use this model for. And then another one, kind of even deeper, is what is called continued pre-training. So this is where you're really bringing in a lot of data that is unlabeled, and then using it to adapt your model to either a specific industry vertical or a domain, so that it can be much more relevant and understanding of the requests that you're putting in, coming back with accurate responses. So really, there are a lot of different approaches, but really the one that you pick will depend on your use case and the quality of the model that you selected prior. So with that, like I promised, I'm going to leave you with something that's actionable, which is this end-to-end generative AI application that you can deploy with a single-click deployment. It is what we call a AWS solutions implementation. In your AWS account, you don't really need to know any of those services. But once you deploy, what you will find is you get a web portal back where you can log in and start interacting with your models on the back end. And the models themselves are from Amazon Bedrock, but you can also bring in and deploy your own models and use it with the solution. And this also has a RAG implemented, which is one of the customization approaches that I just talked about. So it kind of brings everything together, the model selection piece, the customization piece, and how you can use this almost as a model playground to kind of experiment with different models. You can select, by the way, which model you want on the back end as you converse with this chatbot. So something for you to get hands-on and get building. And that's the QR code where you can find this. So with that, happy building, and over to you, Daniel.
So thank you so much for sharing your insights. And I'd love to now have a conversation about layering the real-world application and then the back end of the technology. So Kingsley, I'm going to start with you. If you could, can you explain the power and potential of generative AI to address social impact, and particularly layering it within the low and middle income countries? And what inspired Huron AI to leverage generative AI as a key solution?
Yeah, so many years ago, my very close aunt, she passed on from colorectal cancer. And there were just a lot of gaps in her care. And at that point, when that happened, I never knew or I never envisioned that we would have such powerful acceleration in AI research to where we are today in generative AI. And so that's what has really inspired my career in pursuing a career like in global oncology to improve systems, especially in low and middle income countries. Now comes the advent of generative AI, and then I'm thinking about all the inefficiencies, especially with the numbers I just presented, one oncologist to 3,000 cancer patients. You think about how can a physician really, get all their cognitive abilities in place when they have that, patient overload. And so the questions we asked when we were doing focus groups and figuring out what the biggest pain point is, oncologists said that it's just so difficult to follow up with their patients, and patients inevitably have, side effects and they have problems during treatment and need to be followed and those concerns addressed adequately. And so this was when the spark of generative AI came about. But obviously there were concerns, how would this technology be fine-tuned to the use case in this at this point, and how would the oncologists accept it as a technology to augment their care. And so when we started doing beta testing, when we built and started doing beta testing in Rwanda, we were getting a lot of feedback, and we're iterating the platform to ensure that we're incorporating both patient perspective and the oncologist perspective. And overall, we just wanted to ensure that we can have a system that helps deliver efficient care, helps patients to address their concerns even remotely. And with generative AI and all the fine-tuning you can do, especially with incorporating local treatment protocols, language, clinical context, they just feel that they're not alone. And there's still a lot of work to be done, because every day we keep gathering feedback to know how and where we can improve to make sure that our system is powerful. But I think, and I strongly believe that generative AI is not the magic bullet, but it's definitely a pivotal tool to ensure that we can amplify the work of healthcare workers and relieve some of the cognitive burden that they have in taking care of their patients.
Thank you. And so, Marut, I kind of want to build on Kingsley's response. How have you seen, or could you provide some specific examples of how generative AI is helping nonprofits and other mission-driven organizations help to achieve their social impact goals? And kind of what unique advantages does generative AI in helping to do that?
Yeah, that's a great question, Daniel. So I work with nonprofits kind of across different verticals, and they all have different use cases. But really, the common thread there is, they're all resource constrained, they're budget constrained, things like that. So our nonprofits love the easy buttons, and that's exactly what Amazon Bedrock is, right? And I'll kind of explain the reasons behind it. So if you look at Amazon Bedrock, right, it serves as a hub for high-performing foundation models from leading AI companies, as well as Amazon's own models, and now publicly available foundation models as well. So just having access, so just what Bedrock is doing is democratizing generative AI, right? So nonprofits can, very, very quickly build applications by consuming these high-performing models with just a simple API, and then they can bring their specific data. So I'll give you an example of a conversation that I had with a nonprofit a couple months ago. A lot of things change. This is a very, very dynamic environment. There's a lot of innovation, 2 months behind and now. But the fact is, this was basically a nonprofit that was committed to improving social policy for education and work. And so they were as part of their work, and this is, for education and work for low-income populations. So what they were trying to do was, and they're definitely resource constrained, they were trying to create a kind of a social policy assistant to respond to RFPs and RFIs, because they didn't really have in-house staff that really could understand all the nuances of these policies. But they had a lot of documents, data that they had in different places. And they wanted to build this application that can go access this kind of corpus of trusted data that they have, but have an assistant that they can quickly provide as a tool to their staff to go ask questions and respond to those RFPs.
Okay. Yeah. Thank you. So Kingsley, I just want to dive a bit deeper into something that you mentioned in your presentation about the importance of needing to be culturally responsive or culturally sensitive. So can you give me some examples of how you're leveraging generative AI, or how you're even thinking about it to help make your solution more culturally responsive, particularly as you're thinking about expanding into diverse regions with different languages and cultural contexts?
Yeah, so in building, we first want to have a conversation with all the key stakeholders, because one can read a peer-reviewed journal to see what the problems are from a global scale. But when you talk to people on the ground, when you talk to patients, you talk to the government, you talk to oncologists, it helps you drill down into the biggest pain points and how they want the solutions to be designed. And that's kind of how we approached our product development. And so when we first launched in Rwanda, I just had this assumption that in Rwanda, smartphones, like 80% of the population had smartphones like they did in Nigeria. But when I went there, the numbers were like just 30%. So 30% of the population only had smartphones, and 70% used like regular mobile phones. And so for the patient side, we had to innovate around USSD text messaging because we didn't want to build like a sleek app and then we now leave a lot of people behind. And so patients, we partnered with a big telecom company where we had as bulk SMS, and patients could interact with our platform just on SMS, and we had the web platform for doctors. So that's one way. Secondly, we didn't just assume that, in Rwanda they speak English and French, but lots of patients don't speak any of those two languages. They speak another language called Kinyarwanda, which is actually spoken and understood by 98% of the population. And so we had to ensure that we had options for patients to receive care, in that language. And everything gets automatically translated to English when it comes back to the web platform where the doctors see. So we basically engage, and the engagement is a continuous one. It's not just like prior to building. It's like, okay, now you have this product on your hands. It's providing value. How can we provide more value? What is working best? What is not working? And we keep iterating our platform to do that. Another important aspect I'd like to point out here is just treatment protocols. So, for example, in cancer care, one of the, a major reference point that oncologists use to deliver care is called the National Comprehensive Cancer Network Protocols. And this is developed here in the US as a group of experts that meets regularly every year to review all the evidence and prefer the best, the best care based on all the evidence that is out there for particular cancers. And so for Rwanda, NCCN designed what they call a stratified guideline. So for example, if the guideline for a particular breast cancer is this, it might not really apply to another country because some of those drugs might not be available there. Some imaging might not be available. So the stratified guidelines basically dig down into a country's resources and what they have so they can follow the best next evidence if one is not available. So we had to also incorporate that so that oncologists are not just getting like treatment protocols or treatment guidance that is just highfalutin and they can't really, it can't be actionable in their own clinical context. So these are all the things that we think about in building these technologies so that at the end, the goal is not a feel-good goal. It's like the goal is to ensure that you're really providing value both to the healthcare system as a whole, but more importantly to the patient and the oncologist. And the only way to know that and the only way to really build to be responsive is by always engaging the users and the stakeholders in that ecosystem.
Thank you. And so kind of on the other side of cultural, ensuring that your solution is culturally responsive, Marud, you touched a bit about working with your solution to ensure that you're eliminating bias. Mm-hmm. Can you talk about some like best practices or kind of how you've seen or what kind of recommendations you even have for nonprofits or social impact-driven organizations to ensure that the bias is eliminated so that you can get to that culturally responsive solution?
Yeah, so that's kind of a multidimensional question, I would say, sure. Because eliminating bias, it's a challenge in and of itself, because just by definition, right, a foundation model, especially the first suite of foundation models, they've been trained on internet scale data, which and these are all unlabeled data sets, right? They come with all the inherent biases that are out there. And unless you take additional measures to kind of detect and filter out that inappropriate content or toxic content, biases in the data before you use it for training a foundation model, it is there, right? So that's why I was, previously talking about using a model card, which is a transparency resource. It's typically available, if it's a publicly available model, you will find it like in Hugging Face. If you go, you can look at a model card. It'll tell you what data it was trained on, what are some of the limitations, what are some inherent biases. It'll go into all of that. But really the question is, how do you select a model that doesn't have that bias, right? So this is where you have to choose responsibly. Because if you want your end users to trust the applications that you build, it's your responsibility to kind of go through that rigorous model selection process that I was talking about, having a really rigorous evaluation process so that you choose not just a high-performing model, but a safe model to deploy as part of your applications. So, the most important thing is model selection, right? Something that doesn't come with that inherent bias. And even if it does, during training, there are guardrails put into place so that There are guardrails for detecting any inappropriate content or inappropriate requests on the input, which is the prompt, and also guardrails on the output. So the response is coming back from the model. You need to be able to detect and filter out toxic content. So there's kind of elimination of bias in the data that goes into training, but also having guardrails in place on the input and the output to make sure that it doesn't affect your end users.
So I'd like to pivot slightly. Kingsley, you've talked about working in Rwanda, you're working to scale in other countries, but solutions don't work in a vacuum, right? So being able to roll out a solution really requires collaboration with governments, with healthcare workers. How do partnerships and collaborations play a role in rolling out solutions that are AI driven?
Yeah, no. So at this, our company was launched November 2021. So we're just at the 2-year mark, and so at this stage where we're just now about to go to market, the collaborations play a very, very key role. And so one of the things that we're doing is to help pharma and support pharma companies to diversify, their data, especially for phase 3 trials. And the FDA just mandated, early this year that pharma companies would have to reach certain levels of diversity, or else they will face drug rejections. And we see these populations as one way that they can diversify that data. So we're working actively to collaborate with, pharma to fund some of our trials. And to also, look at some of our pilots so that we can keep, our operations initially sustainable. We partnered with a large kidney center that sees a lot of urologic cancers in Nigeria. And, it's a very well-funded hospital. And so, because we're working with them to solve a very big pain point, they're going to be injecting funding to our company to ensure that they can, pilot our services and scale. For Rwanda, for Kenya, we signed an agreement with the government of Kisumu, which is the 3rd largest state in Kenya. And there is you see an opportunity. The governor of that state, was a former cancer survivor. And we saw that he was very interested in technology. I met him at a conference at Harvard, and he happens to be Lupita Nyong'o's father, the famous actor. But he now invited us that, this technology would be very interesting for their county. And so that was how we made, market entry. But more importantly, we really want to be successful in these initial places so that we can now use that success to really scale. And for us, we also look at what the government's overall national cancer control strategy is. So for example, in Nigeria, even though we've not officially partnered with the government of Nigeria, the Minister of Communications and Digital Economy launched an AI strategy for the country. The new Minister of Health, who was the former interim CEO of Gavi, and he went back to Nigeria to become the Minister of Health, their major strategy is to digitize healthcare because they see the value of really understanding the healthcare data of the 200 million Nigerians. That's the biggest black nation in the world. And so in digitizing healthcare, obviously they would need to, they've already indicated interest that they want to partner with private companies from anywhere around the world to ensure that they can achieve their goal of digitizing healthcare and making it more efficient. So we don't want to, just go into a place that don't even have data as, or technology as a strategy, except to build them into it. We want to ensure that we are fitting into what a government, sees as their roadmap for using technology and improving, healthcare in general in that region.
And we're kind of building on that same question. organizations like Huron are working in resource-constrained countries or in resource-constrained contexts where governments, for example, may not be as tech-savvy or may not be comfortable with using technology and specifically the introduction of Gen AI. What recommendations do you have for innovators who may be in this room who are thinking about working in these types of contexts and how to effectively engage governments to adopt new technology?
Yeah, my biggest advice there is, go up the stack. So what I mean by this is, if you've heard the keynote, Adam's keynote yesterday, he was talking about the generative AI stack. So think of that as 3 layers, right? So at the very top, you have applications that are powered by AI. So these are things like Amazon Q, for example, the business assistant, right? But you also have Amazon Q incorporated and, in general, generative AI capabilities inside contact center, inside business intelligence tools. We also have that as part of other AI services as well, recognition for one, where you can do custom content moderation, things like that. So these are the kind of, these AI services which already have generative AI infused in them are really the top of the stack, right? And then one level below is Bedrock, Amazon Bedrock, with not just its foundation models, but also its managed capabilities like knowledge bases and agents that are now available that can kind of come together to implement that RAG workflow that I was talking about, where you can use that approach for customization to improve the accuracy, relevance, and context specificity of the responses coming back, right? So that's kind of that middle layer. And now there's also guardrails for Bedrock that's been announced. So that's that middle layer. And then below that, is the infrastructure for if you wanted to train your own foundation models and for inferencing. So when I say go up the stack, what I'm saying is pick those easy buttons. If your use cases fit, those services and their capabilities, start with those. If they don't, then that's when you kind of start coming down the stack and doing some of your own building.
Well, thank you. So before we get into the Q&A, I have one last question for both of you. So as technology like Gen AI evolves, what are some of your recommendations for how innovators in the room and out in the world, how do they continue to track how the technology is evolving, but then also how it fits into the evolving needs of health and health equity?
Yeah, so what I'll say is it's still, we've made a lot of progress, but we're still early. The potential is enormous. And for us to really track and see where we're going and ensure that we're still being impactful, it's about engaging the users, understanding there's a plethora of problems to solve in healthcare, in climate change, but just to keep looking at the data that is published out there, but talking to the people on the ground to really understand what can we build to be impactful. Or even if you have a product out there already, just figuring out what can I do or what can your team do to ensure that you continue to remain impactful in the space. And the only way to know that is just to keep talking to your users and monitoring and getting both the data that is being gotten just by their usage and data gotten from talking to the users. That'll be my take on that.
Okay, thanks. Imran?
I would say just get hands-on. Really, there's no substitute for experience. The best way to learn technology is to get your hands dirty. And that's why I was, kind of gifting you that little end-to-end solution. But there are really easy ways to experiment and interact with models. For example, there is this new tool called PartyRock, which is really a complementary to Amazon Bedrock. And what PartyRock is it's a foundation model playground. You don't need to have an AWS account. You just kind of log in with your social media account, and then you have access to an environment where you can build generative AI applications with no code whatsoever. And then you can build them. You can select the foundation model that you want to choose. You can, once you build it, you can share it with the community, things like that. I mean, I would say just get hands-on, find all the resources there are. And I think with Party Rock, you actually get certain number of free credits as well when you get started. So, get your hands dirty. And as, it's a very dynamic landscape. There are new models coming out, new versions of models coming out all the time. So, one of the things with these model playgrounds is you're also kind of getting really savvy with the prompt engineering, which is a very important skill set, I would say, these days. English is your new programming language, if you will. So get really good at prompting, prompt engineering, so that you can get the best possible response you can from a model.
Well, thank you. And as you all are going back into your organizations and driving your own social impact digital solutions, AWS is committed to supporting your growth and your innovation. And so we have a resource called the AWS Health Equity Initiative, which is a $40 million 3-year commitment to supporting organizations using the cloud to address health disparities as a means of advancing health equity. And you can receive...
We are recipients, yeah. It's a great program.
Exactly. And organizations who are accepted into the program can get up to $250,000 in promotional credits, as well as technical expertise. So we want to encourage you to continue to innovate to drive social impact. But thank you all so very much. But I'd like to open up the conversation to the audience. So does anybody have any questions? Well, thank you everybody so much for participating in this conversation. If you have any questions, please feel free to reach out, but I'd encourage you also to take the survey to evaluate the presentation. Thank you so much.
Thank you,
Thanks
everyone.
so much.
Thank you.